I'm going to talk to you about why I decided to pursue medical school and wanted to become a doctor. So the reality is there was no one moment in my journey where I was like, this is the exact time that I know I'm for sure going to be a doctor. Rather, it was something that sparked my interest. And then over time, I did my research and got experience that further solidified that decision. So my first exposure to medicine in general was through all the sports injuries that I had in high school. And if there's a sports injury you can think of, I've probably had it. Tore my ACL twice, split my head open, broke my wrist, whatever it is. I was probably seen by the orthopedist, ER doc, or plastic surgeon for it. And this was my first exposure to medicine as a patient myself. And I think this is pretty common. But when I saw, especially when I needed surgery, an ACL surgery in my junior year of high school, and I saw the intricacies of healthcare and how many people worked with me and the surgeon and how he was able to see me as a patient, then operate on me, and then my post-op care and check-ins, I really started to develop a strong passion for what healthcare professionals do, and specifically the doctor role. And that's kind of what made me think, maybe this could be a field that I could see myself going into. So as a result, I decided I'm going to look more into it and really do my research before becoming a pre-med student. And so junior year going into my senior year of high school, over the summer, I did a program at Johns Hopkins where basically you were like a medical student for the week. And so during that week, I got to sit in on med school lectures. I got to do some shadowing. I actually got to do a patient simulation as if I was one of the physicians on the care team or medical students. And we would go in, we talk to the patient, and we had to try and take a history and then figure out differential diagnosis. It ended up being like a patient that had type 2 diabetes. And I just remember the relationship that, even though it was like a paid actor, that I was able to build in that short period of time, centered around one of the most important things, which is somebody's health, really spoke to me as a potential future career. And I've at the time especially was like, couldn't imagine any other career where you can get that type of intimate relationship with people, which I really, really enjoyed, but also have to apply this complex knowledge that I was excited to learn more about, the human body, anatomy, physiology. And so at that moment, I decided I'm going to be pre-med, and I wanted to continue to work towards ensuring that this field is for me. And so throughout my undergrad years at Cornell, I continued to get shadowing experience, make sure that I was able to keep up with my pre-med prereqs, and just learned about the healthcare system. That's why I actually minored in health policy, so that I would understand the system itself better, because I think that's really important going in. And the more I spoke with doctors, the more I saw sometimes not always the good sides of medicine, but also saw the great sides of medicine, and specifically being a doctor and having an immense understanding of how to treat patients, really down to the pathophysiological level. And so that level of expertise is what I really wanted one day when I'm going to be able to treat patients and lead a team, hopefully. And so that's why I decided that I wanted to become a doctor, and went through pre-med, applied to medical school, and now am about a year away from actually achieving that dream. So that's a little bit about my background. Hope that was helpful. I kind of just did this off the cuff. It's been a while since I gave this answer for like a pre-med interview, but I hope that was helpful for you guys. I'm interested to hear what your journey of figuring out that you want to be a doctor is, and drop that in the comments below.